What's one word to describe the future of healthcare?
Healthcare. I mean, in a lot of ways, healthcare today is sick care. So I think just describing healthcare as healthcare in the future and
I
that
like
being an
that.
accurate description.
And you're starting to see that, right? You know, like I'm part of like Life Force, and they come draw my blood every 3 months and look at all my biomarkers and change my supplements, and that's very much preventative, health care. Is I don't feel well, and what kind of drugs can you give me to make me feel better? Sick care. I like that. Yeah, so a little bit more proactive and preventative care. Welcome back to the Ignite podcast. Today, we're delighted to have Susan Conover. She's the co-founder, CEO of Piction Health, one of our recent portfolio companies, and just closed the price round recently. Congratulations, and welcome to the program.
Thank you so much, Brian. I appreciate that. Excited to be here.
Would love to get an intro from you for the audience.
Sure, yeah. So I'm Susan Conover, obviously, as you just introduced me. So I'm co-founder and CEO of Piction Health. We're a virtual first dermatology practice where we diagnose, we treat, we prescribe, we solve the end-to-end problem for patients with hair, skin, and nail issues. And I'm originally trained as a mechanical engineer, worked in management consulting, and really missed product development and building things. So I came back to school to MIT to go deep in that. That's when I originally moved up to Boston. And I've had melanoma 3 times and struggled to get in to see a dermatologist. And so realized that there was potentially an opportunity for improvement in this space and use of technology when I was in school. Used my thesis to explore the area. The more I learned about it, the more I realized patients are waiting behind Botox patients.
That's crazy. We're all backed up by Botox.
Exactly. It's not that it plays an important role, I guess,
Hey, you gotta look good.
Yeah, I mean,
if you're gonna die, you're gonna die, but you gotta look good.
So realize that there was just some areas that could use more access to care, especially in the medical derm space, and it's enabled by virtual care, and we have a really cool database and AI system to support our providers in managing many more cases. And so realize that, I mean, it's definitely, entrepreneurship is not easy. Right? You're like, okay, build a team.
Turns out this is actually hard. Yeah. Way easier just to go get a job at MIT. What was that kind of decision-making process, as you're wrapping up this master's degree and you're kind of like, I'm going to go tackle this problem? When was that aha moment for you?
Yeah, I mean, I think I evolved into it. I originally focused in school on design for developing countries, and then at some point shifted into the medical space as I discovered and learned new things and in school. But I'd say it's something that I really care about, that I learned when I went into the details of my own medical experience. I would talk to a melanoma expert who was like, you should have had this test and not this test at this time because it would have been much more sensitive, or all these different things that I was just like, how are patients supposed to know? How are they supposed to get access? It was just I kept learning more and more things that were more and more concerning, and realized I have tremendous access to care, and other people don't even have a dream of the access that I have, especially today. And so realized it's a it's a hill I'm willing to die on.
That's awesome. So walk us through the inception. How'd you find your co-founders or your team, and what is the organizing process for the startup?
So I think finding your co-founder is one of the hardest things.
I see a lot of founders struggle right there, right from the inception. I have an idea, and I need a co-founder.
And I need someone who will take tremendous professional risk and not get paid, and just do it because we believe it.
Yeah, leave that cushy job, because you probably have a lot of skills, right? And you're making a boatload of money, and let's go do this crazy thing.
Because you're smart and capable and could easily get a million other jobs. Exactly. So my co-founder and I actually met at an improv class in Boston when I had first moved here, and I think it's a more, I don't know, every co-founder relationship story is so variable and different that it's almost impossible to be repeatable. So I think in some ways it has very limited utility for anyone listening to this.
I love this origin story of the improv class because because if you meet somebody at improv and you kind of are gelling, right, then you'll probably work well together because you're basically improv is like, it's like a lot like work, right? You're kind of improving this startup together.
Exactly. I mean, I think especially in today's like corporate world, I feel like there's a lot of like doting on if you figured out like, oh, they have a regulatory problem, or like basically being critical of ideas. And so in improv, it's the opposite of that. Like, no idea is a bad idea. And it's all about building and listening. And so I think it's like in a lot of ways the opposite of what a lot of people's corporate experiences are. But then yes, exactly, that's what you need to do in a startup, is to create something and like get feedback, figure out what people like, what people don't like, keep iterating, go in an endless cycle. And so I think it's the perfect place to meet a co-founder, because it's like beginning from creation, and no idea is a bad idea.
And then so Piction Health basically uses AI, computer vision, to help dermatologists, not replace them, but help accelerate their ability to detect and treat skin, nail, and hair conditions. Was it?
Hair, skin, and nail issues are in the category of dermatology conditions. Exactly. The first, actually, few years of this company, we partnered with dermatologists around the world to bring in a photo collection that's representative across not only different diseases, right, or body parts or age groups, but also skin tones, to make sure it was representative, and then built an AI system at the performance level of a dermatologist.
Interesting. So you actually partnered with the dermatology practices to get pictures of the actual skin condition. So you're building up your own proprietary data set, not just grabbing stuff off the web or whatever.
On initial glance, the web has some different resources, like a prototypical example of some different diseases. There are some collections of de-identified magnified photos of moles, but there's really not representation across different derm conditions, especially not across different skin tones. And so, but just like a resident learns by seeing a lot of cases and then reviewing textbooks and all these different things and getting feedback on like what conditions a patient had. AI is similar, right? It works in the same way of distinguishing different features. And so realized we needed that core initial data set, and that we didn't realize it wasn't available until like we went to build it. And we're like, okay, first we need to, do the hard thing of get the right representative data, and then, deploy that in a clinical environment.
That's very cool. And then, so as I recall, the way it works is you are direct to consumer virtual dermatology, right? And you actually have dermatologists on staff at Piction Health.
Yeah, exactly. So every case is reviewed and approved by a board certified dermatologist. That's a really important part of our model. And then we have different technologies and, prepared things in the background that help our providers deliver care more simply and easily. So like number one complaint across all providers, not just dermatologists and people in the derm space, is documentation. It's just literally like clicking annoying boxes and getting weird error messages in an EHR. Right? It's like the biggest barrier to care. Who'd guessed it?
Yeah, we have some portfolio companies trying to solve this, but yeah, it's the monopoly that Epic Systems has, right, on the space.
That's its own story. It's the whole thread there. But yeah, and so we've created systems, and they're specifically sort of designed in and for derm cases, to make it really pretty like simple and easy for them to like focus on practicing at the top of their license, and like making those decisions, like offloading like cognitively burdensome decisions, so they can really simply and easily provide access to many more patients than they otherwise would be able to access.
Yeah, I love this idea, right? Because it's verticalized medicine basically delivered with the latest technologies. Because it's kind of like all this timing thing, right? You have obviously everyone now has a phone with a high quality camera, right? So they can, and then everybody has pretty much a computer with obviously the internet and cameras and microphones, and then computer vision also just got good enough to classify these at scale say the last like 5 or 10 years. And so all this kind of comes together, and then you have COVID, which everybody's now used to getting like remote care, and the timing just seemed perfect. Like, is that how you felt from the beginning, or?
I mean, I wish that certain things happen, and I would say I thought 4 years ago was the right moment, and now I think this is the right moment, right? Because COVID and because a lot of different things have happened. But I think like if we look at the examples of like mental health care, over 50% of care just today is delivered online, and that's by far the like leading of the pack of different virtual specialty practices doing remote care, and some are just limited, right? Like how are you going to get a kidney test? Like you can do lab work and stuff, but or primary care if you want to get blood pressure or something like that, you have to be thoughtful about that. In derm, it's so visual, right? You always start with what something looks like and then want to understand some of the circumstances of like how long it's been there. Is it itchy? Some of the things like that. But dermatology is just one of those specialty areas that's really fits in well with the technology advancements today, both in computer vision and AI, and then also with smartphone technology, right? Like every company is like, we'll make the best selfie software, and turns out the best selfie software is also really good for taking photos of skin, right?
I love that. And so you get the co-founder, you guys start wrenching on this. Is it right before COVID, it sounds like?
Yeah, exactly.
Wow. Okay. And then so COVID happens, and then you guys went through an accelerator as well, right?
Yeah, we've been through a few that have been helpful. So we did the Techstars Boston program in 2019, and then we've done Mass Challenge just before that.
Why did you do two, right? So like I've seen this with some founders, they do two or three, and each of those is, 5 or 7% of dilution, basically. Like, why do multiple accelerators?
Yeah, so we only did one accelerator that had that bigger dilution hit.
The Techstars, yeah.
Yeah, and it was definitely worth it. I mean, it's one of those things that like if it's X%, do you think your company's gonna benefit or grow by more than X%? Because if the answer is yes, then that's always it.
Yeah. I mean, you only got to, yeah, if it's 7%, you only got to grow 10% or something like that to make up for that dilution, right?
Exactly. So in some ways it's and we and in a lot of ways we've like it was a multiple of that, right? So it was well worth it. I think those decisions are important and hard for when you don't know, right? If you're kind of coming in being like, we hope this works, but we're able to see like PillPack and some other companies go through the same process and be able to hit these extreme levels of growth. And so we decided for us the trade-offs were worth it. But it depends. Like for some cases, it's like 80% of running a startup is the same startup. It's best hiring practices, best different best practice areas across the field, and then there's that 20 plus or minus percent that may be customized to your specific field or area. And so in a lot of ways we think about like what's specifically in healthcare, setting up revenue cycle management to be able to build payers, bringing on providers, like all these different things that are very specific to our industry and our business. And so how do we staff and make sure we have the right support and resources to do the 80 and the 20?
And so Techstars was helpful with all of those things that you mentioned.
Especially the 80. That's why I bring it up because it was a more generalist program.
Yeah. Yeah, big fan of the program. And we obviously have a YC focused fund, which is all YC companies. But I always wanted to do Techstars as well because I respect that program nearly as much, if not as much, as YC. For founders out there, what else would you tell them about applying to Techstars and going through it, and why else was it worth it?
In some ways, I think it's sort of just like before I went to MIT. I don't think I had that like confidence or self belief that I could like start a company. I feel like that's at the and then I got into it and I was like, oh, maybe I could do this. And so in some ways it like gels the company, but then also I think Techstars has like a sort of three-pronged approach with the 3 months that you're in the program is like setting up your KPIs and your systems and processes to make sure you're focusing on the most important thing and measuring all those things, and then like network and mentorship to make sure you have like the right community of people who've done it before in various areas, so it can make hiring more straightforward, and fundraising, a variety, but network. And then the third is fundraising. And so I think it's got a sort of comprehensive approach that like it's what startups need, even though if you ask a startup what they need, it will always be fundraising, and that's the only answer, right?
We're all just raising money from each other at the end of the day. Or selling to each other. Yeah.
But the other things are also very important, right? And growing a company. And so I think it has but I'd say
So you come out of Techstars. So how long's the program?
3 months. Yeah. So we started 3.5 months, came out of the program, I want to say like May 2019.
May of 2019. Okay. So you kind of went in. How far along were you guys when you entered?
We had built a product and launched it, and we're growing our user base at the time. So we've had a couple of shifts and pivots along the way, but yeah, pretty early.
And this is an important thing for founders out there listening to hear, right? Like, 2019, we're now sitting in 2024. So we're 5 years later, and you're just now closed your first priced round.
A second price round.
Second price round. Yeah. So it takes a long time. This stuff takes a long time, right? And it's something that we look for in our founders is like the stickiness, right? The vision, the long-term thinking. Because you're going to pivot, like you mentioned. Maybe like what were those pivots? What was that like?
So our first shift was from a patient could anonymously review what likely conditions were a match for what they had, and then get connected to a doctor.
Almost like a lead gen for doctors. Like, hey, take a picture of your mole, and we'll send it to doctors, and then we'll match you, and they'll give you an opinion.
Yeah, and then we realized that like a bigger, more valuable, but more also ambitious product would be helping every doctor have the visual expertise of a dermatologist. And so we built a database, an AI system, and that launched with PCPs, and that was growing, I believe, 27% month over month in terms of user growth. But what was lagging was like the sales side of things and getting enterprise and hospital and clinical network contracts. And so for a few different reasons, one was the pandemic, one was and remote care being covered in a way that before the pandemic it wasn't covered. You had to like do weird stuff and jump through 3 hoops and sell to employers in order to get that. And then we were just starting to see more of a model for virtual specialty care come out. And so we realized that we could, and then the fundamental question is like, are you solving the full problem for the person who cares? The person who cares at the end of the day in derm is the patient. And so we realized if we had a practice and we could use our technology and AI and other resources in that practice to deliver scaled, high quality, affordable care, that we could like solve the full problem for that person who cares. And so in some ways it was just different chunks and expanding and almost like,
Vertically integrating, right?
Vertically integrated.
That's the business. Pulling out my MBA knowledge here.
Yeah. And so I think at the end of the day, that's the fundamental question. Like, who are you solving the problem for? And is there someone willing to pay for that, right? And are you doing it in a compliant and legal way, all those different things. And so it's something that evolved, and we listened to the market. And one of the other things is like those primary care physicians that were using our product, a lot of PCPs were like, I just don't have time. Like, I just need to refer. I just can't. No one will take my patients. My patients are waiting 3 to 6 months to get in, and that's my problem. So we're still solving, the original problem from a patient perspective, and also the PCP, but in a different way than we thought originally.
There's this economic theory called the Jevons paradox, where when things get more efficient and cheaper, there's actually an increase in demand. Paradoxically, you think there'll be less supply, but there's actually more supply. Do you think, given kind of AI-enabled dermatology, will actually just increase the access to care? Basically, just more dermatology will get done, basically, in the economy.
Yeah, I mean, so these days, primary care, urgent care does high percentage, certainly over 50% of all derm cases, but they just don't have the extensive training for diagnosis or appropriate treatment. That we just see a higher error rate, of course, versus dermatologists doing these cases. For what we see now, like the supply and demand difference for dermatologists is 4 to 1, right? We are missing 30,000 dermatologists that would be happily and fully employed if if they were available in the US, right? And so certainly I think a lot more derm will get done because there's just a lot of patients who are just not going to wait or not going to call 10 clinics to see who can get them in, or like a variety of different patients that are just being not served today. And so hopefully, yeah, that will increase supply is the aim. And our aim is really enabling our derms to manage 15 times more patients than they could otherwise manage. I think we're at about 5x right now, and with what we're implementing in the next few months.
A given dermatologist can actually serve 5x more patients given your platform.
Yeah, and then and what we're doing in the next few months will enable that to be more at scale, right? But there's a lot of things in medicine that can be assisted by uh, technology from the 70s. Like, I wish it were, but there's a lot of low-hanging fruit, is what you could say, I think.
So what do you kind of see for the future? Like, what's your kind of vision for Piction Health over the next 5 or 10 years?
Well, I mean, mine has always been like, how do we make sure every patient who needs it can access expert care when they need it, specifically in dermatology. How I see things expanding is like that. Yeah, we're in 4 states now. We expand across all 50 states, and then we, whether it's us doing the care or us enabling others to do the care internationally, I don't know exactly how we want to roll that.
What does that state by state rollout look like? Is it you have to go in and actually get a license to operate in each state? Is that the deal?
Yeah, there's some nuance. So for 45 states, it's foreign qualifying your entity, and then for 5 states, you have to form a separate one. But it's weird PC nuance. And then it's making sure your providers are licensed in those states, of course, to deliver that care, and then you're complying with any state or local laws like oversight laws related to NPs or PAs and things like that. And so our rollout is starting with states that have some of the highest need, right? Like, so some of the longest wait times, combined with remote payment parity and coverage laws, which about half of states have, laws in place that make sure if you're delivering remote care, you get paid at the level of in-person care. So some of it's like just regulatory guided, some of it's need, but then it's generally like we've built a model that works across all 50 states. So getting to each one is needed. Our first state was actually New Hampshire.
Why New Hampshire?
It was close by, and we're in Boston, and there was a higher need, and we realized that we could deploy quickly in that state and be just learning. I think that's the sort of number one principle of startups, is like MVP of like, you'll learn so much more having one patient or one customer go through your system than you'll like do sitting in a dark room for 3 months being like, I think they'll do that. So moving quickly was important to us.
You know what I remember about your fundraise, and why I bring it up is it'd be helpful for other founders, is you were one of the better fundraisers that I've spoken with, right? And it is a skill. So maybe walk us through how you fundraise from VCs, because I think you did a pretty good job. I remember you were on top of things. And what's your philosophy there, and what kind of tips would you give other entrepreneurs?
Brian, that is the nicest compliment. Thank you so much, because I do not feel like fundraising pro. There's a lot of best practices, like too many to list. I'd say, like, one is run a process, right? Like anything, like you have to build a funnel for any part of your business.
Yeah, it's a sales process. Have like a funnel and a CRM, and it's like these are people have not reached out to. Here are people who might be interested. Here are calls scheduled. I've sent materials. I follow up. And what CRM do you use for that process?
Spreadsheet.
It's a spreadsheet. Nice. All right.
And then just always having like the list of here's the hottest ones that have responded most recently and all that stuff. But so I have just a short list, so it's not a full spreadsheet. But
I started with a spreadsheet when I was fundraising. I mean, that's how you get started. At some point, you're like, this is too unruly. I can't handle it, because now I have thousands of LPs on Team Ignite. I'm like, I can't have thousands of LPs in a spreadsheet.
what system do you use?
I use a system called Decile. It's the accelerator I went through to launch my fund, and so they have their own back end system that comes included with the fund admin, and it's not perfect, but they keep building stuff, and it works pretty well, and it comes included with my fund admin. So shout out to Decile Group on that, and they're starting to allow other people into it. You could actually adapt it for, I think, a startup fundraise as well. It's the same kind of process, right? Set up a call. Hey, I'm gathering, and set an appointment here, and yeah.
Oh, totally. Yeah. I mean, I'm in Boston, so like plenty of people I know are on HubSpot, and they would be embarrassed of me saying I use spreadsheets, I'm sure. But yeah.
Well, there's a lot less VCs to keep track of, right? I mean, when you're running a process, it's got to be like hundreds of VCs maybe versus, yeah.
Yeah, it depends on your scale. Like hundreds is manageable with a spreadsheet, but then, higher than 500 probably, then that's when your system breaks, right? I think that's the other principle of startups is when you hit certain multiples, everything breaks and you have to rebuild it.
That's a principle of just building tech, I think. Like, yeah, you're just accumulating technical debt, and you're gonna have to pay. You're gonna have to pay the piper at some point.
Pay at some point, yeah, yeah. And then I'd say like fundraising is pretty human intensive, right? Relationship building, and so like starting with the folks that you think are the best fit for whatever reason, like they've already invested in X companies in the last.
Better to start with kind of smaller investors and get some momentum in the round, or do you kind of go top down with the looking for your lead and trying to find kind of that best fit VC? Or
For earlier stage rounds, which is more my space that we've raised in, I'd say the soft circle approach of just like get smaller commitments of like, hey, assuming we get a full commitment of 500K or whatever it is, can I count you in for 50K or 25K or whatever that is? And I think that that can be valuable, because then when you have someone who wants to write a bigger check or have be on your board or something like that, then you already have everything else sort of lined up. There's also an argument that that's a more inefficient way to do it, right? Versus starting with your lead. I think everyone wants to start with like a lead who puts in 80% and then you're like kind of done. Like that's just never been any of my experiences with fundraising. So I think that both, if you can do the find a lead first method, I think that can make a lot of sense. But then I think also if you start with smaller commitments who aren't leading the round, then that gives you the opportunity to iterate on your like common questions and answers and your story and your pitch. And you have to do that somehow, whether that's
I'd recommend. I think if a founder was asking me how to start, I would do the latter, which is start with some small angel checks, get that 15 or 20 meetings. I think after about 15 or 20 meetings, you're kind of in the groove, and now you can start going to the bigger fish, and maybe you got some commits, and you can make those commits kind of pending, pending the valuation, or however you want to write it up, or MFN or uncapped, or hey, it's a soft circle of 25 or 50K. Get a few of those, and then then you can go to the big ones and say, hey, I'm raising 500 or a mil, whatever it is, and I already have some commits, by the way, and it's just like, oh, okay, well, great, let's talk.
Yeah, I mean, I remember when I first tried to fundraise, and it was before I did Techstars, and I'd be like, we're raising whatever, 400K or 500K or whatever it was. And then I would hear advice like, oh, you should raise more than you need and make sure you have a long runway. And I heard this from like angels. And then I was like, oh, okay, then we're raising $1 million. And then you get the question, how much do you have committed of that $1 million? And you're like, none of it.
It's a delicate dance that I also, as a VC, right, raising a fund, I could say I have a $50 million fund. It's like, great, how much do you have in that fund? I have 1 million. Oh, okay, great. Well, it sounds like you're really far away. Once you come back next year and talk.
Exactly. And but I did learn in a Techstars ecosystem, like there's like three numbers, right? There's the number you really, really want. There's a number you'd be okay with, and then there's your actual minimum that you can like hit a decent milestones to be able to raise your next round. So I'll always communicate the smallest number, and then you can increase, like, oh, well, we were raising 300, but we just saw the appetite for 500. And most, like 98% of the time, an investor is going to be like, awesome, great, there's money around the table. It's not going to be on me, right? To bail you out if you don't hit your milestones. And so I think that is definitely like a best practice that that I think is just a solid way. So you can always, like, the person who says you should raise 1 million or you should 2 million or whatever, they're not committing, they're just saying I'm conservative.
Yeah. And the way that you got to be careful too, because you don't want to raise too much money, because then you're setting yourself up for a big hurdle to hit, right? You raise 500K and you go get 500K of ARR in the next 12 months, like you're in a really good spot to raise another round. If you raise 3 million and you generate 300K of ARR in the next, 12 to 18 months, you're in a really bad spot. Because you just burnt through a bunch of investor money and you have a 1 to 10 kind of capital efficiency kind of ratio, and you might just go out of business at that point, right? Because you've run that P&L into the wall.
Yeah, totally. I mean, so I think it's absolutely, are you, like, we're all like, you wouldn't do a startup if you weren't trying to do something massive and like change something fundamental in the world that doesn't exist today. But yeah, are you like, does your future plan make sense to justify this type of financing, or there's other types of financing like grant funding for NIH, or various other things that you can pursue. And so, like, if you're gonna do the VC route, like angel or VC route, like that's one route, but there are many other financing routes.
I love it. Let's switch to a rapid fire.
Okay.
What is your favorite productivity tool?
Superhuman.
So I tried Superhuman. I couldn't really get into it. What was it about Superhuman? Is it just the shortcuts, the way they kind of lay out the inbox, or?
I think it's the shortcuts combined with, it almost feels like a game. Like when I open Gmail, there's so much that's yelling at me to click. Um, and Superhuman simplifies it, and it's just like, here's your one email, handle it. What your one email, so in some ways it just it's cognitively simpler to use.
Are you able to get to inbox zero? Is that kind of your?
Yeah, roughly once a week.
Yeah, me too. Probably like once a week. Yeah, I used to I used to be very big on folders, and so I'd have to get to inbox zero, and how I would do it is I'd put like to do immediately, urgent. I just to do later, to read, urgent, to read later, and that's kind of what my four categories, and I would always get to inbox zero that way.
Smart. Yeah, I think of it as like anything that's going to take less than 4 minutes, I do right then, and then try to just do it one. Like, don't be like, oh, I'll refer to that later, right? Like,
What book are you currently reading?
Neil Gaiman's Stardust, because it's what my book club picked.
It's like a sci-fi.
Yeah, it's like a fantasy book.
Oh, okay. Who has been your biggest inspiration?
My mom, she's like so no nonsense. I love it. I aspire to that.
You're no nonsense. Yeah, I could see a little bit of that in you. If you could have dinner with any historical figure, who would it be?
Abe Lincoln, because I think I just identify with like a strong sense of justice and fairness, and he seems good at that.
I have an overactive sense of justice. Like if I feel like somebody's cheating me, or like I had this a couple times in Greece where I was like, oh, like we're going on a boat trip, and they're like, oh, you didn't tell us that your kids were over 13. We're gonna charge you as an adult. I'm like, no, no, no. No, 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 no. I told you their ages. Like, like, so stuff like that. Like, I'm like, that's not fair. And I get angry. um, what's one piece of advice you'd give to your younger self?
You'll figure it out, right? I think some people are like born into like an entrepreneurial family and then went down that road, but I think a lot of times people aren't, and there's like product management.
Well, and I think you kind of like my theory of this is your kids end up doing something different from you that you, like just to be different from you, right?
Yeah.
Kinda, right? Or maybe there's a little bit of like, okay, my dad was an engineer, so I'll be an engineer kind of thing. Maybe there's some genetics there, but I think also like kids are kind of trying to carve out their own version of themselves from their parents. Like I have three kids, and it's clearly like one's kind of the nerd, the book smart, kind of wants to go to MIT actually. One's the athlete, is like the jock athlete, combs his hair like when he's walking through campus and stuff. Um, and then my daughter's the youngest one is the performer, right? She's in theater camp and she like puts on plays and writes songs and but those are all aspects of me. Like I play sports. So I'm kind of a nerd, kind of a performer, doing a podcast for instance. But they're all carving out their own identity. Like I don't think they see any of that in me in particular. You know?
This is how I'm different from dad. Yeah, it's fun.
Yeah, yeah. I don't. And again, I don't think we'll see how it's fascinating to kind of watch children grow up and kind of become themselves, right, and find their way. But anyway, what's what's a favorite place you've traveled to?
I in high school lived with a family in the southernmost part of Germany, Bavaria. Yeah, and I grew up in Texas, and so Bavaria's like the cowboy Texas of Germany, and that was a really
Beautiful, beautiful area. Yeah, just
beautiful and also just like different cultures and standards that are just like it's nice to see how a different philosophy.
yeah, different ways of getting things done. That's what I like about travel a lot. Is just seeing how different cultures, yeah, go about their lives, and yeah, the norms and practices are all different. Okay, last question. What's one word to describe the future of healthcare?
Healthcare. I mean, in a lot of ways, healthcare today is sick care. So I think just describing healthcare as healthcare in the future and that being an accurate description would be
And you're starting to see that, right? Like I'm part of like Life Force, and they come draw my blood every 3 months and look at all my biomarkers and change my supplements, and that's very much preventative, health care versus I don't feel well, and what kind of drugs can you give me to make me feel better? Sick care. I like that. Yeah, so a little bit more proactive and preventative care.
yeah, like let's we're dealing with a lot of legacy of why it is the way it is, but like let's actually get it to help people live and thrive rather than not just not not die.
Yeah, we'll keep you alive as long as we can. Um, Susan, thanks so much for coming on. I really enjoyed the conversation. I know lots of founders out there will get a lot of benefit from this. And how can people get in touch with you and find out more about Piction?
So Piction, our website is pictionhealth.com, Piction. So like Pictionary, but just the first part. And then my email is Susan at pictionhealth.com if there's some way I can be of use.
Thank you so much for coming on. Appreciate it.